So thank you very much. That's a great question. So as we will be presenting in our EP highlights section tomorrow, are multiple studies, and some of them are being presented at the American Cardiology Conference. Can you repeat that again?
Yeah, sure. Anytime, anytime. I will do that.
You will there. Okay. So thank you for that question. Uh, with more and more evidence coming from different randomized studies, there is more and more evidence for offering catheter ablation as a first-line treatment for atrial fibrillation. So we are going to touch on some of these studies tomorrow in the EP highlights section. But I think the data is very encouraging. There are now several randomized studies to support the evidence. So I think in the near future we will see more and more patients with atrial fibrillation being offered catheter ablation as a first-line treatment, because antiarrhythmic drugs have poor efficacy and long-term side effects. So currently, we use different strategies for atrial fibrillation ablation. Pulmonary vein isolation is the cornerstone of any AFib ablation, and that can be achieved either with radiofrequency ablation, with cryo balloon ablation, and lately there has been a lot of excitement about pulse field ablation, and tomorrow again we are going to see the results of the Pulse AF study, where they are going to present the data on outcomes of pulse field ablation in patients with paroxysmal and persistent atrial fibrillation. These are the different modalities which are currently being used, and even different approaches. So while everyone uses pulmonary vein isolation for AFib ablation, uh, the jury is still out. What are the other targets to better ablate AFib or to decrease the recurrence? There are studies showing that triggers might be important. There are studies showing that substrate modification might be important. There is a lot of interest in publication about vein of Marshall ablation to improve outcomes with atrial fibrillation. But I'm really looking forward to the result of Pulse AF study tomorrow, because pulse field ablation has really been a very exciting field, exciting development, which in the preliminary studies has been shown to be very, very efficacious and with minimal complications. So there has been a recent publication from NCDR registry which shows that AFib ablation has become really, really safe procedure with really low complications, less than 1 in 100. The common complications are associated with groin bleeding, injury to uh, uh, the vessels, or but things like tamponade, stroke, esophageal injury, and mortality, they have been extremely rare based on the recent studies and recent data, and even the real world NCDR registry of atrial fibrillation ablation in the real world.